get started. So we're going to talk this morning about hormones, optimizing hormones for mothers and optimizing hormones for daughters. So essentially this talk, the body of this talk is really focused on women in their menstruating years. So from when a girl gets her period, when she's going through puberty, through perimenopause. So that is a really wide range, and I'm going to do my very best to try and really encompass the various challenges that can come up, because there is such a focus on these hormonal times of transition, this kind of these teenage puberty years, and then perimenopause as things start to change. But there'll be a lot, we'll talk a lot about kind of what's normal, what's typical, reasons for hormones being off, and what types of symptoms are normal and optimal, and what types of symptoms are just common and typical, but not optimal. Okay, so a little bit about me. For those of you who've done my talks, this will be a little bit of a repeat. I am a US trained and licensed acupuncturist and herbalist. I'm trained in both TCM, in Chinese herbal medicine, and TCM styles of acupuncture, as well as Japanese acupuncture. I'm a functional medicine practitioner. I've been practicing functional medicine for almost 20 years now. And I'll talk a little bit more about what functional medicine is for those of you that aren't familiar, just because a lot of the body of this talk really will be around that functional medicine model for hormones. So I want to give a little bit of an explanation there. Can everyone hear me? Is there anyone who can't hear me? I'm just seeing everyone here. Is there anyone? Can you just let me know in the chat if you cannot hear me? Give me 1 minute. Let's see if we can just sort this out. Okay, good. Everyone can hear now. Great. Okay, so I specialize in nutrition and nutritional wellness programs, which is really part of the functional medicine model as far as making lifestyle changes. I also treat like a very gentle osteopath in a lot of ways. I do a type of therapy called integrative manual therapy, which I've been doing for about 25 years. And it's using a lot of kind of osteopathic based techniques. So different than an osteopath, but just hands-on, very gentle manipulative work, doing cranial work and lymphatic work and organ visceral work and fascial release work. So I kind of integrate a number of different modalities and I weave them into patient care. I've been a therapist for almost 25 years, and I did my bachelor's in California many years ago now. Okay, so the goals for this talk are really to understand that women who are menstruating cycle. So we cycle sometimes daily, weekly, monthly, and we really want to learn how to embrace that cyclic nature that's so inherent to women. And we want to learn how to make lifestyle choices around supporting the cyclic nature of our hormones. And I'm really going to focus on also helping people understand what are the very common underlying root causes for hormonal dysfunction and as they relate to hormones. So again, this talk will generally be focused on women who are menstruating. So not so much for women who have gone into menopause already and who've stopped menstruating. Okay, so let's get into a functional medicine model and what that is and what that means, because a good portion of this talk will be focused around that. So a functional medicine model is really, it's a construct, it's a system, a way to think about the body. And it's really looking at what are the underlying root causes. It is root cause medicine using a systems-based approach, which means going through the various systems in the body and ascertaining for each individual which system has dysfunction. So I'm thinking about gut and digestive systems and the microbiome. I'm thinking about the immune system. So a lot of women and a lot of people, Frank, are in an autoimmune where the body is attacking itself, and just what someone's immune competency. I'm thinking about detoxification, the various pathways, which becomes very important in hormones. So we're going to think about, can you make hormones, but also you got to break down hormones. So detoxification of hormones, particular estrogen, but also testosterone is really important. We're going to look at energy production, mitochondrial function. Can the person meet the energy needs for what their lifestyle needs? So mitochondrial dysfunction is really, really common. We're going to talk a lot about the communication system, especially hormones. So hormones and neurotransmitters, more the brain communication system with the body. And then potentially think a little bit from a functional medicine viewpoint. I'm thinking about, are there structural or anatomic issues? Are there problems with lymphatic drainage? Are there problems with, you know, the actual physical organs themselves? Is someone not getting adequate blood flow in and out of an area? So I think about those types of things just because I practice a type of structural manual therapy. So for me, that's part of my functional medicine thinking when I'm thinking about all the different types of underlying root causes. And we're going to talk a lot about lifestyle practices. So, you know, the 4 big important things: diet, nutrition, sleep, exercise, movement, and stress management and stress management strategies. Okay, so once I start to look at and think about these for an individual, part of the process when I'm working with someone, it's really to investigate using very objective data points. So I'll go through in a minute lots of different lab tests, objective markers that I look at, but also a very thorough case history. So I spend 2 to 2.5 hours with each new patient kind of hashing out their whole medical history. And I put together those objective markers with that thorough case history to think about a program that I want to put together for an individual. So everyone gets a very individualized treatment program using a very integrative approach. So everyone's going to get a dietary kind of overhaul or modifications in their dietary program. And then those lifestyle factors, you know, I'm giving people guidance on sleep and exercise and movement and stress management. And then maybe either I'm doing or I'm referring out to for things like acupuncture or dry needling, which I do here in Singapore, or psychotherapy if I feel like that's warranted, or things like physio or osteo, or all the manual therapies I do, or Pilates-based rehab I love is functional rehabilitation, and or other types of body work, whether it's more energetic types of body work or more physical-based body work. So we're putting that whole piece together within this functional medicine model. Okay, and then I talked about that I'm looking at a number of objective data points. So those are the lab tests that I'm thinking about. So I'm always looking at basic blood work with everyone. So we can certainly look at hormones through bloods. I'm going to talk quite a lot about the Dutch hormone panel. Dutch stands for Dried Urine Test for Comprehensive Hormones. And I'll go through pieces of that. Well, I'll have a good conversation about that within the context of this talk because it's so pertinent and relevant, and probably, in my opinion, the best functional medicine hormone-based test available to practitioners and for patients at the moment. And then, you know, there's lots of others. There's stool-based tests I look at for gut analysis. Small intestinal bacterial overgrowth is a breath test that a lot of people can have issues in their upper gut, thinking about potentially food intolerances. And then I'm thinking a lot about toxic load and infection. So toxic load might be heavy metals or environmental toxins, things that we know negatively affect hormones, mold and mycotoxin. And I might be doing DNA analysis based on if I feel like that's a piece of the puzzle for an individual. Okay, so let's get into the body of what is a hormone. Okay, so a hormone, we can think of the hormonal system as essentially part of our communication system. So a hormone is just a messenger molecule that gets transported through the blood and leads to some sort of action in the body. So it's made in one part of the body, it travels to another part, and it helps control or communicate what an organ or a gland does. So within the context of this talk, we're going to think a lot about sex hormone. We're going to think a lot about, so that would be estrogen, progesterone, testosterone. We're going to talk a lot about cortisol and stress hormone, and a little bit about epinephrine and norepinephrine, or sometimes called adrenaline and noradrenaline. So we're going to think about stress hormone, and then a little bit about melatonin, sleep hormone. So there's a number of other hormones, but within the context of this talk, that's really going to be the focus. Okay, so I mentioned a little bit these female hormonal times of transition. So as female sex hormone is coming online in puberty, so there can be a wide range. Some girls start really early, closer to 8. Some girls are starting just the beginning of their teenage years. And then we're going to talk about perimenopause, which for most women starts in and around their mid-30s until they, hopefully gracefully move into menopause when their period stops for a year. So that's really the context of another talk when we get into menopause. This talk is really going to focus on kind of from puberty through perimenopause. Okay, so let's get into our periods. So menstruation, a lot of people have kind of quite strong feelings and thoughts about their period. I think some of this is really established when we're quite young. Maybe we see how our mothers experience their periods. Some families are very open. Some families are really closed off and don't talk about it at all. I know I always heard the story growing up that my mother thought she was dying when she first got her period because she had never, her mother had never talked about it with her. And she really had no idea what was happening. She was at school, got her period for the first time, and thought she was dying. Whereas I grew up, so my mother did something very different. I grew up in a family, my mother has 2 sisters. Between them, there's 7 granddaughters, and it was this very female-centric home where it was a huge celebration for each of the kind of cousins or granddaughters as each one of us got our periods. And it was a much more positive, positive ideas in the way we talked about it, and very, very open. So a lot of people really hate their period, frankly. They hate the symptoms that they feel. They have quite negative associations. I mean, pretty much this woman in this photo with, leaking through her white pants is just pretty much every woman's nightmare, to be out and get your period and not be protected properly and have it leak through your pants. So there are, a lot of people are really stuck in their symptoms because a lot of women have, quite intense signs and symptoms, which I want to talk you through and get you starting to think about how we might be able to shift those and change those and support those. So some of those symptoms might be happening pre-menstrually, that week, or sometimes women have 2 weeks leading up to their period of quite intense, irritability, breast tenderness, headaches, fatigue, lack of libido, anxiety, food cravings. I mean, there's so many different things. For some women, it's a real relief when they get their periods. And for other women, their period themselves, that first few days or that first week can be really symptomatic with cramps and headaches. And again, maybe fatigue or abdominal pain. So again, we'll get to talk about kind of typical and normal, because it is quite typical to have symptoms, but it's, I'm going to talk you through what I think is a more kind of normal, optimal presentation throughout your cycle. And then if you're not having that, we're going to start to think about how can you figure out what is going on with you hormonally. Okay, so getting to know our female anatomy a little bit. This is a nice picture of the uterus with the fallopian tubes and the ovaries during our bleed week and kind of that week leading up, or those 2 weeks leading up to our period as that endometrial lining is growing. If there is no egg that gets fertilized and needs to implant, it will slough off and we will get a period. And then the difference in size can be quite remarkable when our period is kind of about to come and we have this very thick endometrial lining, and then more at the beginning of our cycle, excuse me, post our bleed week. So it's, excuse me, it's really important to understand that we cycle. So we're going to talk about week 1 as being our bleed week, when this endometrial lining sheds off. Then we go into the follicular phase of our cycle, which is this beginning phase of our cycle where a hormone called FSH, which we'll go through a hormone chart in a minute as the hormones are fluctuating. One, is starting to prime the follicles, getting ready for one lucky follicle to get chosen, which will happen in ovulation. And that one follicle that comes out, if it encounters sperm, and that becomes kind of the start of where the egg and the sperm meet, we then move into the luteal phase, where that lining, that endometrial lining, is building over that last 2 weeks of our cycle, where progesterone comes in a big way and helps this process happen. And if an embryo if there's some sort of fertilization, the embryo can potentially implant in this nice thick endometrial lining. If there is no embryo, no implantation, then we go back to our bleed week, back to our menstrual week. So again, this just keeps going on and on and on. And hormonally, what's happening is we start out really low with all our hormones, except for FSH, this blue guy, follicular stimulating hormone, which, as the name kind of insinuates, it's going to stimulate a follicle to grow. So the follicles are growing in the context of FSH showing itself in those first few days, first week of your cycle. Estrogen starts really low at the very beginning, but starts to build up really quickly, and you have quite a big buildup. Quite a big buildup of estrogen, moving towards ovulation, towards mid-cycle. So estrogen takes a huge rise at the end of this first week, moving into this second week. LH, luteinizing hormone, really primes us for ovulation, for the release of that one egg. So luteinizing hormone comes in closer to ovulation. In this map, that's showing us mid-cycle around day 14. Ovulation can certainly happen earlier, and it can certainly happen later, but you get this LH surge mid-cycle. And then progesterone, the orange hormone, really shows itself post-ovulation and creates that environment for that endometrial lining. So progesterone is really happening in the second half of our cycle. Okay, so let's talk a little bit about normal versus typical. So it's very normal for women to have, let's start with typical. It's typical, so common, usually a lot of this is abnormal, to have really painful periods, periods full of symptoms, premenstrual syndrome, or a lot of symptoms leading up to one's period, people being very irritable or very emotional, kind of especially the week leading up to their period. And it's really typical for women to really just dislike their periods, not have a positive relationship with their periods. My goal often, if I'm going to work with a woman hormonally, is to move her more towards normal, optimal. So the leading up to period, the bleed week itself, I generally want to be uneventful. Some women are having symptoms in other parts of their cycle, but I'm wanting signs and symptoms to kind of quiet down. But we also want to put in context that there are these weekly changes, and we want to respect those. So I'm going to go into those. So there are weeks where you might, and there are days where you might feel a little bit more fatigued, and there are times when you might feel a little bit more emotional, but it's always a spectrum. It's always a spectrum. So we don't want huge symptoms that are interfering with life. We want symptoms to be much more muted. If symptoms are kind of bigger symptoms, oftentimes there's an imbalance there. So we also want to know that it's really common to have irregularity in our cycle, especially in the teenage years, as that brain communication with hormones, with our ovaries, is really just establishing itself. So, I do hear, and I think it's quite common for young girls, maybe, 15, 16, 17, to go see a doctor and say they have irregular periods, and maybe they're put on birth control. And for a lot of these girls, if they're not, if it's not really as birth control, but to control symptoms, and I'll talk a little bit about hormonal birth control later, a lot of these girls, it's just that communication between brain and the ovaries, that hypothalamus talking to the pituitary, talking to the ovaries. Oftentimes that communication signaling has not been completely formalized yet. So ideally, we really want to get girls in particular towards a normal cycle. And then it's really common as women are moving into their, certainly for most women in their mid-40s, you start to see some irregularity again in cycle as the ovaries are slowly going into retirement. And sometimes hormones are signaling and you're not getting that kind of optimal hormonal signaling. And that's a normal process, because eventually, as we move from perimenopause, maybe in our mid-30s towards when we lose our periods, just the ovaries are slowly going into retirement. So I really want to move people towards harnessing these weekly hormonal changes. So instead, we can think about our periods knowing that there's certain weeks where you might feel great, and it's a great week to just action things in your life. And there's other weeks where you might be a little bit more internal. So there is that component to our cycles. And if we can get to know that, especially when we're young, it's really powerful to be able to adjust things like your diet and adjust things like your movement and adjust how social you are around your cycle. It can be a real superpower. Okay, so if we're having signs and symptoms, or what I'd call kind of suboptimal period, we want to start to look and investigate. Oftentimes it's because the hormones are imbalanced. Maybe there's too much of one, not enough of another. So looking at the levels, and the Dutch panel, which we'll go through, is probably the best way to do that. You can certainly look at hormones through blood, but we don't get to look at as wide of a array. It's not as big of a picture when we look through blood. Sometimes it's because, again, we're not detoxing well, we're not breaking down our hormones through the optimal pathway. So sometimes we have too much of a hormone, not necessarily because we're making too much, but maybe we can't break it down properly. And that can create like an estrogen dominance type syndrome. The liver plays a massive role in hormones. The liver makes cholesterol, which is the backbone for sex hormone, for estrogen, progesterone, testosterone. So the liver helps us make our sex hormones, and it certainly helps us break down our sex hormones. So if the liver is strained because of toxic load, because of other reasons, our hormonal health can be off. So we certainly want to think about and look at liver. Gut is also a really big, important part. We need to be able to eliminate things properly. And if that's not happening, hormonal health can certainly be off. A lot of our immune system also sits in our gut, and it can be a big source of chronic systemic inflammation, which can negatively affect hormones. Blood sugar plays a huge role. Blood sugar, insulin, we need to get that right. So insulin hormone's another hormone I'll touch on a little bit here. Getting that right is also really important for overall hormonal health. Inflammation, so again, can be inflammation that's more gut digestive driven. Some people have more local inflammation. Some people have more systemic inflammation. So certainly I'm wanting to look at all those pieces, because that can be a huge driver of potentially maybe why we're breaking down our hormones in the wrong way or on the wrong pathway. Or just not making hormone properly or not breaking down hormone properly in the first place. Nutrient deficiencies are also really important. So I'll talk about some of the basics in and around nutrient deficiencies. So magnesium plays a really important role in driving some of the genes that break down our estrogens in particular. So we'll think about which nutrients are really important throughout our cycle, and lifestyle factors also. If we're not sleeping, we're not moving, we're super stressed, all of those will negatively affect our hormones. And then just thinking about, there's a number of conditions which can negatively affect hormones. So polycystic ovary syndrome, amenorrhea, just not getting a period, what's going on there, endometriosis, fibroid cysts, kind of all those things. Okay, so let's get into our week one. We're going to kind of break apart the various pieces here. Okay, so all sex hormones, our bleed week, all sex hormones are low except for follicular stimulating hormone at that first week of our cycle. This is a week where we tend to need more sleep. So I generally want women to be sleeping, giving whatever their sleep window is. If they're thinking about doing it, giving themselves an 8-hour sleep window, during this bleed week, you want to make it 9 hours or 9.5 hours, even 10 hours for some women. Getting more sleep will be really helpful and nourishing as you are losing and shedding your endometrial lining. Especially the first few days of this week, this can be a time as women are having, oftentimes women can have a little bit heavier bleeding, can be depleting. So we can have the need to be a little bit more internal. This week is not a great week to make to action big decisions in your life. This is a much better week to just mull things over, to just kind of process what's going on in your life, because week 2 is such a great week to action. And we'll talk about that in a minute. From a diet perspective, with progesterone being really low at the beginning of the cycle, this is a great week to do potentially longer fasts. So I generally have women do a minimum of 13-hour overnight fast. But this week, if women want to push it to 12 hours or 13 hours or even up to 16 hours, for some women can do that very gracefully and very easily for their bodies. This is a really good week to do that, because we don't, with that low progesterone, it just, our appetite's generally not as much during this first week of our cycle. This is a great week to do lower carb, high fat. For those of you that are into or interested in ketogenic, it's a good day to do a real female-centric ketogenic diet this week. And then just know that the first few days of your cycle, you may need to wait on these things. This might not start till maybe day 3 or day 4 of your cycle for a lot of these things, because those first few days of our cycle, we want to be very gentle with ourselves when a lot of women are having their heavier bleed days. From an exercise perspective, the first few days, certainly you're thinking more gentle. Walks are really great. The movement that happens in walking through the pelvis is fabulous. So less intense exercise the first few days, lots of walking to help just with the movement through the pelvis, will help with cramping and other things. Lower weights, lower reps for those of you that are doing weights. This is a good week to just kind of be gentle those first few days and slowly potentially building up throughout the week as the estrogen is starting to pick up. When having lower estrogen the beginning of this week, and this week in general, means that our ligaments are going to be a little bit more lax. So it is a good week to do more HIIT explosive power training, to the extent that someone feels like they have the energy to do that. Probably not in the first few days though. And from a supplement perspective, the things that I think are really important here are really the basics. So things like your omega-3s, your magnesium, your vitamin D, your electrolytes and greens, and potentially some green powders to make sure that you're getting all those nutrients in as you're losing things. Okay, so going into week 2. So our pre-ovulatory week. So week 2 is building up to ovulation. This is where estrogen takes that huge spike upward. So it was starting to build in week 1 and it really takes off in week 2. Same with testosterone. So women don't think so much about testosterone, but this is the highest testosterone week of the whole month of this 4-week cycle. So what's really great about this week is it's a fabulous week to build muscle. Testosterone tends to give us more confidence. It increases our libido. We tend to kind of like look good, feel confident. So that's why this is such a great week to action something. If you need to, you know, ask your boss for a raise, if you need to, you know, just do a big presentation, you know, for kids in school, they don't have as much control over, you know, what's going on in school and when presentations are made. But just to note that, you know, throughout your teenage years, this week too, building up to ovulation is kind of a look good, feel good, wanting to be more social month. And you want to, again, you want to just accept and really work with these, you know, cyclic hormones and make life choices around that. So because of this high testosterone, and it's a great week to build muscle, we tend to want to have more protein and a little bit more carbs than we did in week 1. And we tend to want to do a bit shorter fasts. So you might find yourself, if you start to tune into it, maybe wanting to do a 12, you know, or a 13 to 14 hour fast, as opposed to a 14 to 16 hour fast in this week. Certainly lifting heavier weights is really great. With this high estrogen this week, the ligaments are going to be a little bit more lax. So it's good to do things like steady state cardio this week. Same supplements as week 1 for this week. Okay, and then moving into week 3. So week 3 is our post-ovulation. So we have ovulated, we had that nice LH surge, an egg, a follicle got released, and we're moving kind of beyond ovulation. So progesterone spikes after ovulation. So that's why if women are using their basal body temperature to track ovulation, it's not great because you don't get your progesterone spike until after ovulation. So better to use different types of trackers that maybe can track luteinizing hormone. But you will get a slight increase in your basal body temperature post-ovulation once progesterone really starts to kick in. So this is a good week for, again, going back similar to week 1, potentially longer fasts. It's a better week for lower carb and higher fats. But this week, women can tend to start to have cravings, carb cravings. So if that is you, really nice to add in what are called resistant starches. Got a little tickle in my throat this morning. So I'm just going to use my liquids. Okay, so resistant starches are things like potato starch, green plantain, green banana flour. These, when we integrate them, so we can mix them with a little bit of water, we can put a little bit into our smoothies. I like to have women buy unripe or green bananas and cut them and freeze them and potentially put a little bit in the smoothie or something like that. But that's a way that you can use resistant starches to help curb some potential carb cravings. It's good to increase our green leafy veg this week to help build our endometrial lining, which is starting to happen week 3 and week 4, and can also help with some of the cravings. Mood-wise, a lot of women are generally feeling good this week. Progesterone coming onto the stage. It's great for brain. It's great for mood. It's great for relaxation. A lot of women have really low progesterone. So that's something that's really important to look at and test. And we look at that in the Dutch test in this luteal phase, kind of about a week after we ovulate is a good time to test that. This is a good week for just moderate weights, maybe doing some yoga. And supplements we want to add, other than the basics, we might want to add some magnesium and some B vitamins to really help us as we're building this endometrial lining. We need a little bit more nutrients. And some women need more gut healing this week, so that can be important for women. Again, that's going to be really individualized. Week 4, so this week right before your period, a lot of women are having premenstrual syndromes and a lot of symptoms. So breast tenderness is a really common one. I'm thinking about the balance between estrogen and progesterone here, which is I'm gonna be able to look at very clearly on the Dutch hormone panel. also in bloods if we're doing bloods during these times. So we're building our uterine lining. We want to generally increase our calories this week. I know for a lot of women that's scary, but we want to do it in the context of a whole food, nutrient dense diet. As we're building up that lining, we just need more nutrients. So we need shorter fasts. We want a little bit more protein, a little bit more carbs. Tends to be really helpful and does not tend to lead to increases in weight. Although that's, when we're thinking about weight, I always like to look at one individual at a time because there's so many different factors that play into this. Increasing our healthy carbohydrates and our resistant starches again in this week if there's cravings. So our healthy carbs, the things I like to have women focus on for carbs are generally the non-grain carbs. So things like sweet potato, root vegetables, parsnip, turnip, squashes, taro root, lotus root, beetroot, kind of all those starchy tubers and root vegetables are the healthier carbs in how they affect your blood sugar, how they feed your gut lining. So those can be important. I like to have women do these at night, especially because they can help your sleep. How much carb a woman has or needs is always going to be a bit individual based on what's going on with blood sugar, what's going on kind of with her individual picture. So that's going to be a more individualized thing to go through with a clinician. More fiber, more veggies this week. We want more bowel movements. We want to make sure our bowels are moving well. Mood-wise, we can be a bit slower this week, especially towards the end of the week, and maybe want to be a little bit less social. And we want to respect that. We want to respect this kind of cyclic nature on all levels. This is a good week to do maybe a few more recovery days from an exercise perspective, more gentle exercise, maybe a bit lower weights. But for women that have the energy, this can be a really good week also for HIIT because your estrogen is low again. And again, this is going to be the basics with some of those extra nutrients like magnesium. Certainly, if you're more symptomatic, we want the magnesium, we want the B vitamins, a good B complex with the methyl Bs in them, and potentially some gut support, and then more nutrients with food. So those are the 4 weeks. I love having women and girls track their cycle. I think it's really, really important. Super easy in today's day and age when we are all carrying around smartphones and we all have apps. So track your cycle. For those of you, with daughters, if your daughter has gotten her period and she doesn't have a period tracker on her phone, make sure she has one. You want to certainly always put in day 1 of the cycle so she knows, so she can start to pay attention to the various shifts and ebbs and flows of our hormones throughout the cycle. There's a lot of great wearable trackers. So thinking about those, there's some good urine-based and temperature-based trackers. So a lot of people like the Daisy. There's something called the AVA, it's AVA. If you put in trackers into Google, like period trackers, hormone trackers, female hormone trackers, you'll come up with a bunch of them. There's a bracelet. Some of them also test LH, so to see if you're getting that luteinizing hormone spike mid-cycle. There's some wonderful, I love this book by Toni Weschler called Taking Charge of Your Fertility. It's kind of the first book I ever read that I realized that as a woman, I want to pay attention to what my vaginal mucus is doing throughout the month. I can pay attention to the position of my uterus throughout the month. I can pay attention to kind of various signs and symptoms that my body is giving me to get to know my cycle and when I'm ovulating. And again, knowing that is really powerful. And then we'll go through, we want to learn tools to help support underlying signs and symptoms if they are there. Okay, so let's go into vaginal discharge. If there is vaginal discharge here, I think a lot of people don't realize that we do get more discharge certain parts of our cycle. So it is totally normal to have a very clear egg whitey consistency, kind of stringy, sticky like egg whites the middle part of our cycle around ovulation. So I have lots of women when I do consults with them tell me that they're getting this kind of weird kind of overproduction of mucus during certain parts of their cycle. So if it's happening, so again, track your cycle. You want to pay attention to your ovulatory mucus. It is no matter where you are. So I am definitely very firmly in perimenopause at 48. And there are some months when I don't ovulate. So it's so easy for me to know if I'm ovulating or not based on my paying attention to my vaginal mucus. So there's also times where vaginal discharge or can be dysfunctional. So we kind of want to know what our normal is so we can know when there's a problem. And we want to pay attention if it's yellow, if it's greenish, if it's way more than we normally have, if there's itching, if there's pain, we can use our vaginal discharge or vaginal mucus to help us ascertain what's going on in our body. There's some really great home remedies, like natural home remedies for vaginal yeast infections, for bacterial vaginosis, for inflamed vaginas, for things that are going on. So, I love for women having them take a whole garlic clove, and if they're comfortable with it, peeling it, putting some slits in it, inserting it vaginally overnight. You can do that for, 2, 3, 7 nights if there's yeast, if there's a bacterial issue. Having baths with a cup or 2 of apple cider vinegar in it can be a really nice way to alkalinize and shift some things in the vagina. There's some great kind of natural pessaries. There's some wonderful female-centric probiotics. There's herbs that I use. So there's really a lot to do here. To support naturally. I'm trying to have women not constantly run for medication, certainly not antibiotics, because that in and of itself really disrupts the flora of the vagina. So, just making sure, wanting girls to know and wanting women to know that there are other options. So working with, someone like me or a natural health practitioner who really focuses on women's health. Okay, so let's get into testing. So again, I love the Dutch hormone testing. Dutch stands for the Dried Urine Test for Comprehensive Hormones. It's a very great way to look at yourself objectively from a hormone perspective. It looks at sex hormone breakdown products, stress hormone, melatonin, and various metabolites or breakdown products of certain nutrients that are needed. So things like B12 and B6, certain things that are needed to help us with making hormone or breaking down hormone. Dutch also makes what's called a cycle mapping, where you collect saliva throughout an entire cycle, and you can see how estrogen and progesterone are moving throughout an entire cycle. So this is really great when women have, they're always having symptoms, a certain week of their cycle, and I really want to get a better sense of what's going on through the entire cycle. The cycle mapping is great to do. I'm not going to go through that one in detail here, but I wanted to show you a couple of slides on just the Dutch Hormone Complete panel. So besides looking at the hormone levels, looking at DHEA sulfate, the best way to look at DHEA in the blood and in the urine, we have to look at it through something called DHEA sulfate, where sulfation through one of the phases of liver detoxification has happened to DHEA, and you have a sulfate added onto it. This gives us a sense, DHEA is what kind of the backbone for our testosterone and estrogen, what turns into those. So having low DHEA, I might expect lower testosterone and potentially lower estrogen. This person has really high estrogens. So the other piece that we're going to look at, and I'll show you here, is the total DHEA production. So sometimes DHEA sulfate is not an accurate indication of how much DHEA is actually being produced when we look at it in the context of how the adrenals are functioning. So this test is much more nuanced than just looking at DHEAS, which is really what we see in blood. So this looks really low here, and testosterone is low. And then these are my testosterone breakdown products. So this person looks like they have more of a PCOS phenomena, where they're making this like super testosterone or DHT. They're making too much of this. This is not a good way for testosterone to be broken down. So they're not making that much testosterone, but the way it's being broken down is terrible. And then we also have this really high estrogen dominance as in comparison to progesterone. Progesterone's really low, estrogen's really high. And I think one of the most important things on this test is how we're breaking down our estrogens. This 2OH pathway is our preferred pathway. This pathway is the one we like the least. This is our really DNA damaging and can potentially lead to our estrogen-driven cancers. And this is our more proliferative pathway that just helps tissues grow. So maybe women who are breaking down, so the pie for this person is a lot of 16OH, not enough of the 2OH, and the 4OH looks okay. So this patient might have more endometriosis or fibroids or cysts, like things that are growing where they shouldn't be growing. So these are all really important things. I'm really, really, really cognizant of how women are breaking down their estrogens and their testosterones and helping support that process. That's a really important piece. And this gives us a little bit of an indication of how a woman is doing something called methylation. So can she move from this 2OH and to this 2-methoxy on this biochemical pathway? Requires methylation in a gene called COMT, which is magnesium dependent, which is why magnesium is so important for the breakdown of estrogens. And then the Dutch test also looks at melatonin, and it looks at adrenal and adrenal gland function, so stress hormone. So after a woman is done cycling and she moves into menopause, the adrenals become even more important because that's what still is making hormone. So we want to be very cognizant of our adrenal health leading up to menopause. So, I'd say probably, at least from our 30s onward, we all know that it's a bit easier to burn the candle at both ends, and you can have high stress and you maybe don't sleep as much and you don't move as much and maybe your diet's not as good in your younger years, but we really pay the price as we move through the decades of life. And as women, preserving our adrenal health is going to dictate how gracefully we move into those later perimenopausal years and certainly into menopause. The adrenals are, this is like our insurance policy. So keeping these healthy is really important. So we get an indication of the total DHEA production here. We get an indication of total cortisol or stress hormone. So when I look at what's just the cortisol here that's free and available in the body, it looks really low. It looks really flatlined and bad. And I'm getting a really low number on free cortisol. But when I look at what's happening at the adrenals, when I look at total cortisol production, this person is making cortisol. So there's some sort of issue here as to why that cortisol is not available for that person. So this person's probably fatigued, but maybe they have a picture of chronic inflammation. Maybe they have a picture of insulin sensitivity. Maybe they have a thyroid dysfunction. So there's a number of reasons when I see this clinical picture of the adrenals are working to make cortisol, but it's not becoming free and available for the person to use. This is a very common pattern. And this is an inactive form of cortisol. So this test just gives me so much information. So definitely, if you're going to think about running one test for hormones, that would be the one. Adrenals and stress, I already alluded to, is a really, really important piece of hormones. One, because kind of stress hormone and progesterone come off the same biochemical pathway. But besides that, our adrenals and how well we treat them, again, kind of dictate how gracefully we're going to move into those later years of perimenopause. So we want to be good to our adrenals. So cortisol is one of the main stress hormones. We want to understand what influences it. When people think about stress, most people think about external triggers. What's going on with my relationship? What's going on financially? What's going on work-wise? What's going on kind of family-wise? That's what most people think of as stressors. someone like me really focuses on and hashes out what are your internal stressors. Is your blood sugar bouncing up and down throughout the day? You know, what's your insulin sensitivity like? What are you eating throughout the day? Are you sleeping? Are you, you know, having toxic load exposure? All of these things are internal stressors, and they create a very similar stress hormone reaction. So for those of us that feel really stressed out, yes, you want to look at what changes you can make in your external stressors, but you absolutely need to also look at what's going on with your internal stressors. And that's where functional medicine just is so wonderful and really shines. Thinking about getting your breakfast right is a really good, important way. If we can set our insulin on a good path throughout the day, we can often set our stress hormone on a better path throughout the day. So I generally have people do no carbs for breakfast, focusing if you are going to eat breakfast, it's going to be more good quality protein, veg, and good healthy fats. So that's kind of a great breakfast. We know from research that that's a really good way to start your day. And then thinking about also nighttime routines. So many of us are like constantly on our screens and so addicted to screens throughout the day, but also at night. So our nighttime routines, making lifestyle changes to shift that is really important, because again, those adrenals, we need to preserve them as we move into our perimenopausal years. Thinking about both, I think for teenagers have a lot of external stressors, a lot of pressure with school and thinking about college and maybe relationship stresses, friendship stresses. So what types of tools do we have to manage stress? So I try to have people think about rest and restore mode, and there's lots of different tools and they might all not resonate with you, but thinking about doing something every day to rest and restore, to get yourself, maybe that's breathing, maybe it's meditation, maybe it's gentle exercise. A lot of people will tell me they exercise for relaxation. The problem is if the exercise is a sympathetically driven, like high stress type exercise, then that's not parasympathetic or rest and restore mode exercise. So it's got to be much more gentle. Walking in nature can be great, you know, connecting with someone, a significant other or a good friend, just people you can really be yourself with, reading a super relaxing book, no like heart thumping books. And ideally trying to get off of screens at least an hour before you go to bed, just spending some time in parasympathetic every day. Okay, let's get into nutrition. So start with the basic premise. If we want to support hormones through nutrition, we need to eat real food. Things that we might be eating that are not supporting our hormones are going to be all the packaged, processed, refined, sugary stuff. So we want to generally avoid the foods in this picture, and we want to be eating real food, fruits, vegetables, good quality protein, good quality carbs. That's kind of, you know, good quality legumes if we can tolerate them. Want to eat real food. Okay, so what does that actually mean? Good quality proteins. So protein, certainly if you're thinking about hormones and hormonal health, we don't want to be eating proteins full of hormones, steroids, antibiotics. If we are eating animal protein, we want it to be good quality. So good quality eggs, pasture-raised organic, grass-fed organic meats as much as possible, wild fish, eating good quality fats. So those would be things like avocados and fresh coconuts and organic nuts and seeds, organic olives. So all of those things, we want to be adding those to our meals, and then good healthy fats and oils. So no refined vegetable oils, nothing with canola, sunflower, safflower. We want to be focusing on organic extra virgin olive oil. We want to be focusing on maybe coconut oil. I think cold pressed avocado oil is the best oil to cook with. Very stable at high heat, no taste. Coconut oil can be good to cook with, you know, butter, ghee can be good to cook with if it's good quality butter, but those things will more have a taste. Eating lots of multicolored veggies. So kind of, you hear this a lot, eat the rainbow, kind of 1/2 to 2/3 of our plate. So ideally, as we get older, also, I'm wanting about 2/3 of our plate. And just think about color and variety. Cruciferous vegetables, so cauliflower, broccoli, bok choy, arugula, Brussels sprouts, kale, kind of all those guys are really helpful for helping us upregulate some of our detox pathways that will help us break down our hormones. So for women, I'd love to add in some of those cruciferous. Of course, this is all in the context. If you can't tolerate any of these foods, then you'd be potentially working with someone to kind of tailor make it for you. Minimal to no processed refined foods. That's processed refined grains, processed refined sugars. They just don't help us, certainly hormonally. I think anecdotally, most women who are cycling do better on low to minimal grain. So that would be potentially cutting out the glutinous grains are going to be wheat, oat, rye, and barley, but also the gluten-free grains, which are rice and quinoa and millet and buckwheat and amaranth. I find women hormonally, especially if you have a lot of hormonal symptoms, do much better on a low grain diet. So eating your carbohydrates in the form, again, of those starchy tubers and root vegetables. So your sweet potatoes, your yams, your parsnip, your turnip, that kind of stuff. Eliminating inflammatory foods is really helpful. It's really helpful for gut. It takes a load off of our liver, so helps us detox better, generally makes us think better and think clear, and certainly helps our hormones. So again, this sometimes needs to be individualized. So thinking about things like gluten, dairy, processed refined sugar, and potentially other inflammatory things, which again might be individualized. Lots of good quality filtered or bottled water. We want to be drinking fluids throughout the day. I'm a big fan of electrolytes. So getting those in, they can be really helpful, especially in Singapore. We're sweating a lot here and we're losing minerals a lot. So certainly adding those in. I already talked about eliminating the unrefined oils. So the reason why we want to eat this type of way is it helps our hormones, but it gives us more nutrients, so we're more nourished. It allows us to have better blood sugar control, which helps our mood, helps our weight, helps us think better, gives us more energy. It acts as, we want to eat foods that are really nourishing and feed our gut, our good, healthy gut bacteria. Easier to have proper weight control when we're eating a nutrient-dense whole food diet. Helps us make the right amount of energy throughout the day. Our energy shouldn't be kind of fluctuating so much throughout the day. I don't mind people having one coffee in the morning if they let their brain turn on by itself first, especially just needs to be organic because it's a really pesticide and a really moldy crop. I love the Bulletproof coffee because Dave Asprey, his Bulletproof brand, is also mold and mycotoxin tested and tested for chemicals. So it's a lot of people who maybe don't do so well with coffee do much better with his brand of coffee. And just eating this way helps our liver stay healthy. It helps us make hormones in the right way. It helps us break down hormones in the right way. It helps with detox. It helps our skin. It helps with fat loss. It helps us sleep better. So kind of all of these, there's so many reasons to change your diet. Like to me, changing your diet is like getting the foundation of your house right. It's very hard to build a good house if you don't have a good solid foundation. So I always start people with dietary changes. From a supplementation perspective, a lot of this is individualized when I'm working with someone. So just to put that in context, but if you were going to do just the basics to take throughout your cycle, omega-3 fatty acids, most of us eat tons of omega-6s. A lot of us don't need omega-6s, but sometimes people do need different other fats, but most people need omega-3s, an essential nutrient. We don't make any on our own, so needs to be taken in through diets and supplements. Magnesium is probably one of my all-time favorite supplements. Even if you're eating a perfect diet, it's really hard to get enough magnesium. So I generally want magnesium in the glycinate form, maybe in the malate form. Magnesium is a great thing to take throughout your cycle. Thinking about potentially a little bit more during those weeks of week 3 and week 4 when we're building up that endometrial lining. Magnesium is also great if someone is having like cramps. It's a really relaxing mineral. So, getting your girls into magnesium. If someone doesn't want to take supplements, you can get magnesium salts, take magnesium baths. There's magnesium like oils or topicals that people can use. Hard sometimes to get enough high enough a dose. I like to often have people take magnesium twice a day. Certainly if stresses are a lot at school or at work or in your life, magnesium is great to take in the morning and great to take at night. There's also magnesium for the brain called magnesium L-threonate, which can be fabulous, especially if there's a lot of people are feeling a bit scattered in their brain. Vitamin D is incredibly important for hormones, for bone health, for immune health. So that's a very easy one to test in blood and supplement accordingly. B vitamins, B complex, especially the second half of your cycle, really important. A lot of women cannot detox properly without having the Bs that help support methylation. So B2, B6, folate, which is B9, B12, not in the form of folic acid for most people, not in the form of cyanocobalamin for B12. We want the methylated Bs for most people. So finding a good quality B complex. So we have great stuff here at the dispensary in Balanced Living, where I work. iHerb, for those of you in Singapore, iHerb is also great. In the US, it's, you have access to a lot more stuff, even just through Amazon. Probiotics can be important. Again, we want to keep gut moving. I often will be looking objectively at stool and stool panels and seeing what someone needs. I love electrolytes. I love either Rob Wolf has created an electrolyte formula called LMNT, which make these really great little sachets, very easy to order online, ships overseas, or, in the US, it's really easy to get. So that's great to have every day to make sure you have enough of your sodium and potassium and magnesium. And greens are kind of like the insurance policy. Sorry, and then the cheaper way to do electrolytes would be to get some pink Himalayan sea salt and maybe take a half teaspoon a day. Some people can take more, but a half teaspoon a day mixed with a little bit of water and some fresh lemon juice in it. There's a book called The Salt Fix that came out a handful of years ago. The guy who wrote that, I can't remember his name at the moment, but is on some podcasts. So just hearing about Andrew Huberman did a good podcast on electrolytes recently, but they're really important for women throughout their cycle to keep your electrolytes at the right levels. And again, especially in Singapore, because we're losing so much sodium, like hot climates where we're sweating a lot. Greens are like your insurance policy. If you don't think you're eating enough variety of greens, there's some really great green powders. I tend to like the greens that are organic vegetables in the greens and maybe a little bit of organic grasses and stuff like that. So some of the green powders I think are just trying to do too much. I love a lot of the designs for health supplements, so I use a lot of those. They also make a great electrolyte formula. And then I'm looking at kind of just very individualized. I work with herbs with a lot of women, adrenal support, herbs throughout the perimenopause and menopausal years, a lot of gut and liver detox support, gut support, but that's all going to be based on very objective data points that I'm seeing on people coupled with their signs and symptoms. So other things, so we're almost done here, guys. For those of you that have to go, I know it's being recorded as well, but I will go through questions at the end. Other things just to think about when we think about hormones. So endocrine disruptors are a big deal. There's a lot of things that we know that negatively affect our hormones, plastics being a big one. So certainly getting all the plastics out of your house, definitely never heating anything, storing anything in plastics is really important. So getting, glass and stainless steel containers, water bottles, that kind of stuff. Women tend to slather and cover themselves in all sorts of hormone disrupting chemicals through their beauty products and their makeup. So this can be sometimes for a lot of women a harder thing to change. A lot of women are really married to their products they've been using. They have a real allegiance to them, but it's really important to go for clean products. Environmentalworkinggroup.org, EWG.org is a good website to rate your products, but really wanting to be, there's a lot of great kind of consolidator websites for natural beauty products today, and a lot of people making really good quality beauty products and makeup. So we want to get the chemicals that we are voluntarily putting into and on our body that are going to negatively affect our hormones and really shift in a negative way the estrogen balance. We want to get those out of our lives. Same with chemicals in our home. switching to natural cleaning products. So control what you can control. Diet, what you put in and on your body, and the chemicals you bring into your home. Alcohol is another big one to think about. A lot of women would do well reducing alcohol consumption. It's definitely a byproduct of how well your gut and your liver and your detox system, how much you can tolerate, and certainly choosing, natural wines, biodynamic wines, organic wines, there's a lot of more like keto, low sugar, but a lot of the time, we can think about it, it's just like we're drinking liquid sugar, and alcohol gets priority of being detoxed over other things. So, sometimes we just might not have enough left to break down some of the other things we need to break down. Also, women tend to have less give in their system as they're moving into creeping towards menopause. So in those perimenopausal years, maybe what you could drink in your 20s is probably not what you can drink in your 30s, is probably not what you can drink in your 40s, is probably not what you can drink in your 50s. So just being mindful of alcohol intake and work with a practitioner, a clinician, to see what's going on there for you. Certainly mold and mycotoxins are a really big issue in Singapore and Hong Kong, where I've lived for many, many years now. Heavy metals, more of an issue in Hong Kong probably than Singapore, but a real issue. Mold and mycotoxins in any kind of wet, damp, humid climate, it's a big issue, and it definitely negatively affects hormones, environmental toxins as well. So again, working with a clinician to kind of hash out what's going on for you. I said I'd talk a little bit about hormonal birth control. I think most women know there's nothing that's all that great for women where our body doesn't take a hit. So we don't cycle normally when we're using hormonal birth control. So that brain communicating with our ovaries, communicating with our body, that feedback loop that should be kind of that normal communication that should happen, kind of gets overridden when we take hormonal birth control. And that would be the birth control pill. That would be hormonal IUDs like the Mirena that a lot of women have put in after they have babies. It doesn't allow us to cycle naturally. So there are issues with that. Consider fixing your hormones without using birth control would be my advice. Certainly for young girls, if there are issues, because a lot of young girls get put on birth control for irregular cycles, for acne, for things that are other than for birth control. So I would definitely encourage people to work with a clinician, run a Dutch test, like start to get a sense of what's going on, look at blood work, try and fix the underlying root causes, allow your girls and your teenagers to really establish proper communication between brain and ovaries and brain and adrenals before potentially going on hormonal birth control. Talk about non-hormonal options. There are things like the copper IUD, which is going to be without hormones. There's condoms. There's definitely other ways to do birth control. Think about long-term consequences. So certainly if girls are going to go on the birth control pill, best not to be on it for 20 years, which is really common. Certainly for my generation, a lot of us went on it when we were 16 or 18 and didn't come off of it till we were in our early 30s and we wanted to have babies. So really common to see the picture of being on hormonal birth control, starting young and going on it for a long time. And then all of a sudden we want to have babies and our brain doesn't communicate well with our ovaries. And so it can just take time. So there's a great book by Dr. Jolene Brighton, who's a US naturopath. She wrote a book called Beyond the Pill. There's some great podcasts, but just, consider non-hormonal options, consider taking breaks, think about long-term consequences. I don't have a great answer because I think there's not, a great option where your body doesn't take a hit. And just to be mindful of that and going into, if someone's going to take hormonal birth control, know what the downside risks are, know what's going to potentially happen long-term. If you want to get pregnant at some point, certainly think about going off of it a ways before you want that to happen, to really reestablish that communication properly. Okay, so just to summarize, just really know and respect your cycle. Start to get to know, help your girls get to know their cycles and communication is so awesome, and the apps and the wearables and all this kind of stuff is really powerful to just understand and know, so we can then make lifestyle choices around our cycle. And again, maybe that's shifting your diet, maybe that's shifting your sleep, maybe that's shifting, mood and stress management type stuff. The tools we use to support our mood throughout our cycle we can have different needs week to week. And our exercise and movement. Know that lifestyle changes are often habitual. Lifestyle habits become habitual, and lifestyle changes can really happen faster than we think. For a lot of people, I have them do kind of a stricter month of an anti-inflammatory diet, and already within 30 days, people start to really make beautiful changes. I love for people to make changes as a family. I love for people to make changes with a friend. If you're going to do something with your daughter, amazing, like great to just have that community. Definitely, I would encourage people to run labs, run blood work, run a Dutch test. If there's gut issues, run gut panels. If you're worried about toxic load, just start to look into what might be underlying. Make the changes in your home change the easy stuff, change your products, change the cleaning products, get the toxins and endocrine disruptors, get the plastics out of your life. All those things can be really powerful and really helpful hormonally. And again, I can't emphasize enough how important diet is as just the foundation for hormones. And get supported by a practitioner. I mean, I'm here in Singapore. People can certainly see me here. I do Zoom consults. I work with people, in a lot of countries around the world. So, and there's a lot of great functional medicine practitioners who are very female focused and help women support hormonal health and beyond. So, so that's it. There's my contact details. I want to go through and do a Q&A. So feel free to email me or WhatsApp me. Let me just take a look through the chat box. Please, if you have questions, now's a good time to write them in the chat box. Let me just go through some of these. Yeah, so women who are getting close to menopause, it's a great time to start to think about running some testing, figuring out what's going on, looking at your adrenals, and thinking about the support you need in perimenopause. It's a great time to do that. Again, this is recorded. So for those of you that want to, listen back to it, you can certainly do that. And if you have questions, please feel free to WhatsApp me or email me. If things are really specific about you and your case, anyways, it's better to get in touch with me individually. And if I feel like we need to do a consult, we can certainly do that. Someone wrote here she has to fast before her period or else she's sick. So yeah, certainly I think that if you feel like there's a certain practice that really helps you and serves you, what I've given here are kind of generalizations. I would just say to that person, the days before you feel like you have to fast, you really want to increase your nutrients, because as we need a lot of nutrients to build that endometrial lining. So if you're going to do some fasting, then you want to really go hard with building up the nutrients that maybe a week and a half before you move into that fast. And again, that practice of needing to do that might change if things are, if there are things to be balanced, if they are balanced, thinking again about adrenals and blood sugar and all the different pieces here. Good. And just talking about some things for girls, certainly the period tracker apps, just, I'm maybe leaving reminders around their room, maybe sending a little kind of note or getting a sense of when their cycle is. If there's some regularity, it's easy, maybe putting little reminders on their phone, make sure you track your period. Most girls will tell their moms when they got their period, or maybe you'll notice that they're a little bit more sluggish for a couple of days, and just keep reminding them. And then it just becomes habitual. You really want to get day one down in your tracker at the very least. And if you're having symptoms throughout your cycle, certainly a lot of apps you can add in symptoms in a pretty easy way. or doing, journaling or writing it down somewhere, or, keeping it as notes on your phone. Just, it's really good to know just what's going on for you and what's going on for, your daughter. It's such important kind of information on yourself. And I didn't talk about this, but also a continuous glucose monitor for those people who feel like they're having blood sugar fluctuations, or you just want to see like what your glucose is doing throughout a 2-week period. I know in Singapore, it's really easy to get a continuous glucose monitor. You can literally walk into Guardian or Watson's, and it's like a little plaster with a little, tiny little needle that goes into your skin. And in real time, it monitors your glucose level. So then you get to see like the carbs you're eating, maybe the alcohol you're drinking. It's a really fabulous way to drive behavior change. Some people find there's certain foods that really spike them. For some people, maybe that's rice. Like grapes tend to, if people are fruit people, and they eating a lot of fruit, seeing how different fruits affect you and finding the ones that we don't like when we spike high and drop low. That's a stressor. So we want to try and avoid that. We want the more kind of slow burning carbs, low glycemic index carbs that take us up slow and drop us down slower. So all of those things are really important. So it doesn't look like there's any more questions. So I'm going to sign off, but please get in touch if you have questions, or, I'm always happy to hear comments or feedbacks on any of my talks.